the official position of the union. Thank you.
Good morning. Thank you once again for coming to our weekly briefings and for the support that you have shown us as a union during this COVID-19 pandemic. We are grateful and we look forward to keep highlighting the issues and the status of preparedness in the country as a union in the healthcare sector. So first and foremost, would like to thank the President for his leadership and direction during the COVID-19 pandemic. To note is that he has continuously appreciated and sought counsel from healthcare professionals. And beyond that, we equally thank him for recognizing the role of healthcare professionals by awarding them with the Uzalendo Award last week on 1st of June during the Madaraka Day celebrations. We say thank you for that, and as healthcare professionals in this country, we shall continue providing our services and counsel whenever required for the greater good of our country. We'd also like to empathize with Kenyans for the tough times that we are all facing. We are aware and we acknowledge the survey on coronavirus conducted by InfoTrack and released yesterday. And it highlighted several issues, but more importantly is that majority of Kenyans are worried about the capacity of our country to deal with the COVID-19 pandemic, and that the three key issues for Kenyans were food security, poverty and unemployment, and access to healthcare. And we all know that the mitigation measures some put in place have actually had an impact on access to healthcare. So it is important that as a country we put forth a clear strategy to ensure that there is continued access to healthcare services even with curfews in place, and that no one faces brutality by the police and the authorities that have been mandated to actually ensure that we are all safe. And we thank Kenyans for their support, acknowledgement, and actually ranking healthcare workers top in their response and role and the good job done in COVID-19. In fact, this rating has actually increased from 58% in April to now 77% in June. So we thank you, Kenyans, and we shall stand by you by ensuring that we are available to serve you whenever required. We note and acknowledge and welcome the directive by the President during his 8th presidential address, and actually the observation that our counties are not yet prepared to handle a surge in cases. The past 1 week, we have all seen the triple digits in the daily rise in cases, and we anticipate that in the next few days we shall actually hit the 200 mark, going by how the figures have been going. So that means that for this month, we are likely to see an exponential increase in cases. That said, we actually welcome even the decision to hold a summit between the two levels of government to ensure that the directive to set up 300-bed isolation facilities in each county is achieved. With that, We equally, as KMPDU, state that the infrastructure setup is important, but more important is the human resource function and the human resources required to run these facilities. If these facilities are set up in our current scenario, where the healthcare workers are in their current numbers, they are not yet enough, then we will still not be able to achieve the desired outcome. We have the projections that each 300-bed facility will require in terms of human resources for health. 636 doctors, 1,000 nurses, 360 clinical officers, 572 laboratory personnel, among other personnel, including porters, morticians, cleaners. And so we appeal to the summit as it convenes to consider further budgetary allocations for the HRH component. And we acknowledge that so far 8,000 have been hired, but these projections that we have to ensure that there is quality and efficient service delivery in the isolation facilities is an additional 5,000. And due to this, and noting that there's a directive to employ, we know that there have been interviews conducted by the Public Service Commission. This directive has taken a month. We note the continuous conflict between the two levels of government with regards to handling human resources for health, and noting that we're in a devolved system of governance where health is actually a shared function. As KMPDU, we recommend, and noting that we are having the discussion and the directive, the direction of constitutional amendments, that the Health Service Commission be considered as one of the constitutional amendments. We presented this to the BBI Steering Committee, and we also appealed to the committee as they retreat to do the final report that they will consider human resources for health and the Health Service Commission as one of the amendments specifically for the health sector. We know the amendments will cover different sectors, but for the health sector, a Health Service Commission to manage human resources for health is essential. And we'd like to thank the government equally for listening to our plea and directing that NHIF extends its functions and operations to provide health insurance for all public servants across the two levels of government. This was done through the Gazette notice by the CS Treasury, and we also thank the CS Health for taking it upon himself to ensure that NHIF comprehensive civil servant scheme is extended to all public healthcare workers across the two levels of government, and including even our retired civil servants. And so, with that directive, we urge that all county governments implement the Article 6 of the Collective Bargaining Agreement 2017 to 2021 on health insurance. It is the best cover for public servants, and we do not want instances where we've seen counties contracting private.
Naam, ni muungano huo wa madaktari